Hi, this is Steph. Wasn't I really wasn't planning on putting anything up after the last video, which was our medical industrial police state. Um, but I just had a few more things I wanted to put out there. First of all, for anyone that is familiar with me, um, the 17th of this month will be 1 year since Mike had his fatal cardiac event, and it's been surreal. I mean, it's been Mike and I never had company, or we didn't have family or friends that came over, and I still don't. I mean, I do have family. I have a huge family. They just don't want to bother with me for some reason unknown to me, but uh the only person that has come in my house has been my one neighbor across the street, and the only reason she comes in is because I mow her lawn. So she comes over to pay me for the month for mowing the lawn. And then she stays for 5-10 minutes, and she's clearly very uncomfortable, and she'll chit chat for a few minutes and she leaves. And so, I have a phone. I keep it turned off because no one ever calls. I mean, I use it to make a phone call once in a blue moon. And nobody calls me. And if there's any, companies or scam artists or anyone else want to call me, well, that's too bad because my phone's turned off. And as far as I know, that might be one of the very few things still legal in this country, is to just have a phone but not keep it turned on. I could be wrong. I don't know. There's not too much that's legal anymore, but um, I hope people are realizing that the American empire is in collapse. The current uh, Mango Mussolini is a guy I follow, Larkin Rose. He's an anarchist. You should check him out. Guy makes a lot of sense. He's here on YouTube. But he calls him Mango Mussolini, and things aren't going to get better, folks. I mean, if you're putting your hopes in a red team or a blue team, I mean, they're all playing on the same team, and we're the ones that lose, not them. And, you think they're hurting buying groceries, or I don't know what they do, eat out or order it. I don't know. I can't imagine some of these people in Congress like pushing a buggy through Walmart, getting their tater tots, and who knows. But we're in collapse, okay? And my main focus is medical because that's where I worked, and thank God I'm not in that miserable profession. I loved my profession, but see, I really liked helping people, and I thought I was helping people, and I think I maybe did help some people because that was my intent. I wasn't power tripping. I wasn't, I wore a uniform and all that jazz, and a lot of people bash that. And I don't want to get into a big tirade about the uniforms and maybe people being designated as a captain or whatever. But I will tell you, when you go on a call, like especially say like a big trauma call, or like a big auto accident, it does help when you get there if you can look around and you see like a different colored helmet, typically like a blue or a white, because firemen usually just have black. It helps in that respect that you know who to go to see what they need you to do. I mean, unless you get instructions on your way in. But I've been on calls that were just massive confusion because you had no idea who was in charge and nobody else had any idea what was going on, and it was just a cluster, what, rhymes with puck. So, anyway, I didn't consider myself part of a militarized system, being a paramedic, just because I wore a uniform and some of us had different colored helmets. There's a purpose for that, but a lot of people do power trip, and that's unfortunate. And these days, it's just the power tripping, the incompetency, the lack of compassion is so obvious. You have to be flipping blind to not see that. You have to be blind. And I think overall right now, I've been noticing it, but there seems to be a lot of people online who are like, why is it when you go out in public, like everybody seems upset and angry and so many people are sick and da 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 da. Like, well, maybe people are catching on that these things, they weren't there to prevent anything, folks. They weren't there to make you better. People need to look into it. There's so much information on the internet, and it's been there for a long time. I knew all this stuff back in 2020. But 12 people I'm sorry, I included Mike. Mike and I did not partake in the arm juice. And I don't know if he was collateral damage. I don't know. I can't say, but maybe people are realizing, maybe they aren't, I don't know. But anyway, I just wanted to follow up. I think in the last video I had said that they had called me to make a follow-up appointment for an MRI on my head. And at that time, I think it was November, October. I don't quite remember. I don't have the paper here, but it was not very long since Mike's death, and I was, just wanting to grieve and be in my own space and not be bothered by anyone. And they had to bother me and say, oh, we set up this appointment. And then I got in trouble because, I got kind of upset. And heaven knows we can't do that in this society anymore because everything has to be safe and no one's feelings can be hurt and everything just has to be, utopic. So everyone is just floating around like little butterflies going, oh, everything's so great. So anywho, I did go for a follow-up MRI. First of all, they wanted to put contrast in me, which I didn't want because the stuff's highly toxic. It starts with a G, and I should have looked it up. It's like galadium, or it's something. If you type in contrast, the point is it's very hard on your kidneys. So after the first one with the contrast, the doctor's like, well, I want to do a test to check your kidneys. And I'm like, well, maybe we should have checked them before you put that shit in my, veins. So the second one, I was arguing with him because I told him I don't want contrast. I said, you already did an MRI. You know where the tumor is. You know the size of it. You should be able to do one without contrast and compare the two. No, we need the contrast. All right, fine. I'm so sick of arguing with people. The guy stuck me 3 times, and I'm not a hard stick. I don't know. I do not have bad veins at all. I mean, and then when you put the constricting band on, it's like, if you can't get an IV in me, you better give up. I was ready to go. Just give me the catheter. With my bad hand, I'll do it. Hang me from my ankles, blindfold me. I could probably still get it in. 3 times. First of all, he put the constricting band on, and this guy was like in slow motion, and he was like, oh, I need a stool. Because apparently you can't do an IV if you're just leaning over someone like I've done umpteen times, or get down on your knee, I don't know. But so he had this band on super, super tight, and he leaves the room. It reminded me of Tim Conway on Carol Burnett show when he played the old man. He like just shuffling along. And I'm sitting there, and this thing is digging into me. And he's gone like forever. And he comes back, and he tries to stick me. Couldn't get it. And he's digging. Like, you don't dig. When you pop that in, if you don't get a flashback, you're not in. You can maybe pull it back a little bit and try, but when you start digging in there, you're just digging. You're not. But anyway. So, 3 tries on the IV. They're ready to call the IV team. I'm like, no. I said, I want to get this done so I can go home, okay? I mean, I had to drive like 40 minutes just to get to the place, get the MRI. So, I get a phone call from the doctor's office, from the nurse, And he said, we have your MRI results. I said, okay. And he says, well, they don't know if the size changed. They can't tell if it got bigger. And that was the last it was ever discussed. So, I mean, honest to God, I can't make this stuff up, okay? I don't have the imagination to make all this stuff up. I'm really starting to think there's like a list, because we have lists in this country, and I'm sure I'm on them. But, they do have an ICD code, which is International Classification of Disease. Everything has one. Like if you have hypertension, diabetes, whatever, that all has an ICD code. I believe it's primarily for billing purposes, but if you did not take the coof thingy in your arm, you have an ICD. Well, you have an ICD code whether you took one or not. Why is that? I don't remember years back ever seeing on a patient's chart a whole list of things that they may have taken or not taken. It was just their primary diagnoses, like diabetes, hypertension, heart disease, whatever. But because no one could possibly have this much bad luck with doctors. And I've gone to so many doctors where the first visit was okay, and they really seemed like they were interested in learning about CRPS and different things and trying to help me with something. And I'd go back for a second visit, and their whole demeanor would change. Even Mike picked up on that. He's like, well, why? I had one doctor, I thought he was really great. I go back for a second visit. He comes, he leans up the door against the doorway, and he goes, well, what can I do for you today? Oh, I don't know, maybe be a doctor, perhaps. I like do your doctor thing, because that's why I'm here. So I don't know. I mean, I never once went on a call and talked to a patient like that. I never walked in and said, whoops, what do you need? I mean, anyway, I'm sorry. Sometimes it just leaves me, and I'm not a person who's usually left speechless, but I get to the point where I don't know what to say about these people anymore. Who cast the spell on all the doctors and nurses and everybody else that works in these places? Who did that? I mean, something obviously. I just got out of the shower. I don't know what's going on with my hair here, but it is absolutely insane, and I really don't see it getting any better soon. But also, the other thing is, I was put on Klonopin at the age of 26. I will be 65 in November. Okay? I don't know what I was put on initially, because I when I was younger, I always ran a really high pulse, heart rate. My pulse was like always 120. And I could just sit and count it because I could feel it pounding out of my chest. And it always clenched my jaw, and which would give me headaches. And I got TMJ syndrome from it. And I had surgery on my jaw somewhere along the line. My jaw closed, and I couldn't open it. So I was like this for trying to stick food in a little. I just smash everything down and feed it in there and chew like a little chipmunk. A friend of mine had left EMS and was working as a medical assistant for this doctor's practice. She said, why don't you go talk to one of our doctors? Okay, that's what I did. So they put me on this med, and for the first time in my life, I was like, oh, so this is what people feel like normally, because I knew this was not how you were supposed to feel. My heart rate came down, I was able to relax my jaw and all my other muscles, and the headaches went away, and I was like, wow, this is great. And I didn't have any side effects. It didn't make me tired. It didn't make me feel goofy. It just felt normal. And no one ever told me anything about this. And, back then, I didn't have the internet to jump on and do a lot of research. And even in later years when I did have the internet, I fault myself for not doing the research. That's on me. But when is there ever going to be accountability in this country for anyone? Because this is criminal what they do to people. I don't know what they started me on, maybe a 0.5 milligram or 1 twice a day or something. I have no idea. That was 26. I was 26. So, some years back, I told the doctor who was prescribing it, because I was up to 8 milligrams a day for at least 25 years probably at that dosage, which is extraordinarily high. But I started tapering before I ever told the doctor, because I had a feeling what was going to happen when I said I wanted to taper, which is exactly what happened. It's weird how I can figure those things out. So I'm tapering, and finally, he was rewriting the prescription. I was filling it. I was kind of hoarding it because, I wanted to make sure I had plenty to withdraw when the eventuality came that he told me, well, he basically argued with me and said, you need to stay on that. I said, well, how do I know I need it unless I can get off of it? If I can get completely off of it, then we can figure out if I need to stay on it. Because I said, at this point, I'm just taking it out of habit. How do I know? So he argued with me. He really got upset. And this is not an isolated incident. I mean, if you go online, believe me, there are probably hundreds of thousands of people that get stuck on these meds, not just benzos, but, antidepressants and all kinds of stuff. And when they go to get off of it, they're left on their own, which is exactly what happened to me. And thankfully, like I said, I'd been tapering for a while. So when we had that argument, I'm like, all right, guess I'm on my own. So 7 years I have been tapering. Now I'm down to just a 1/4 milligram once a day from 8 milligrams a day. It has taken me 7 years of tapering. And I'm hoping I can just do the 1/4 milligram for another week or two maybe, and then just get off it completely, because I'm tired of having this umbilical cord to this pill bottle and having, being dependent on it. And let me tell you, you feel horrible when you come off this stuff. And, I really wish that I could just get an attorney and sue him for damaging me and then just leaving me out to dry. Well, then go do it on your own. And I was really having a lot of trouble, so I recently contacted his office. No, I'm sorry, I sent him an email directly. And of course he gets back to me and he's like, oh, well, I really cut down my hours and I'm not doing my private practice, because he works in the hospital. And I just shot him an email back and I said, yeah, that's pretty much the response I figured I'd get. Because that was my argument when I talked to him. I said, you're probably going to retire in a few years, and then what? You up and retire, and then if I can't find someone else to continue this prescription, they love to get you on this stuff, and then for some reason, it's like taboo for anyone else to continue it. I don't know. So, if anyone out there is taking a psychotropic drug of any sort, I'm more familiar with the benzos and the SSRIs, the antidepressants. I'm not sure about the others, but there's a channel, Dr. Joseph. It's pronounced Yosef, Josef. Check out that channel. There's also a channel called Mad in America, which has a website too, madinamerica.com, I believe. And then there's also all kinds of online forums for. I haven't gotten involved in any of those, but you will find that it is extremely difficult. The media always plays it up to make it sound like, getting off of opioids and opiates, like heroin. Oh, it's just the most god-awful thing in the world. Well, I know someone that got off morphine, tapered herself down, and then stopped. She felt bad for about 2 weeks, and then she's fine. That's not what's happening with me. And it's not just me. Like I said, hundreds of thousands of people. And I am just so sick and tired of this medical health system we have. Like I said, it's punitive. It's like a police state medical system. and they don't have to. They don't have to follow any rules. They don't have to be ethical. They don't have to. They don't have to actually treat you. They don't have to do anything. There's no accountability. And I've been down the road before trying to find attorneys, for different things, and I'm always amazed when people say they were able to find an attorney and sue someone, because it is next to impossible. It really is. But just a word of warning. Don't ever stop these meds cold turkey. I mean, I think most people know that, but don't go into like a detox center, or I guess they call it a rehab or whatever, because they will pretty much just take you off really, really fast, kick you out the door and say, oh, good luck, and you're going to need that luck. So, my main premise is I just want people to start stepping up to the plate and calling this stuff out and going, hey, what you're doing is unethical, it's immoral, it's inhuman, it's inhumane, and why do you call yourself a healthcare hero? You're not doing anything for anyone. I mean, maybe there are some people out there who try, I don't know. I haven't been able to find these people. But I just thought I'd throw an update out on my adventures in medical land. Be like a new theme park I could open, I suppose. The like a roller coaster with like a huge syringe. You ride up and down, or the merry-go-round where eventually you just get flung off, and wherever you land is where you land. But then you can have the medics rush in, pick you up and then take you to the clinic, and you start all over again. It'd be great. So, I mean, I'm doing okay. Considering I basically live in complete isolation. I see no humans practically. My young neighbor across the road has been great. He'll come over and help me when I need something fixed, which is pretty much all the time. Or like I can't put string in my weed eater because from using this hand for so many years to compensate for lack of this hand's getting messed up now, and I can't squeeze the round thing, whatever it's called, where you put the string. I can't get it off. If I could get it off, I could get the string in, but I can't. So I'm just waiting for him to come over, but he's working 2 full-time jobs. They just had a baby in July. And, so it's hard for me to bug him and, like, I need this and that. And, I have, like, a million things I need help with, but it's just not fair to expect him to come over here whenever. But, yeah, it's been interesting. My neighbors really showed their true colors. It just blew me away that everyone just ignores me. But I figure that's on them. That's, I can't conceive of treating other people like that. But, I did get a chance to tell off my neighbor. Well, he's not really my neighbor. He just has like a garage over there, and he sells a couple used cars. He uses it as a man cave. He came out early in the summer. I was just putting my mower away. I had just gotten done mowing my yard. And I've got a big yard. I have like an acre, and I have a little house, so it's mostly yard. I have more yard than I have house. So I just put my mower away, and he comes over. He's like, hey, Missy. I've lived here since 2018. This guy doesn't know my name. So he comes over, and he's like pointing to his yard like this. He goes, hey, you think you got time to do this up real quick? I looked at him and I said, you have not said one word to me since Mike's death. Not a word. And I said, furthermore, you said you'd look at my truck. Then you said, oh, I'm really busy and I'll get back to you. And I said, you never did. So I said, you know what? As far as your yard, do it your damn self. And I don't think this man I don't think he's accustomed to people talking to him like that. But I thought, it's your property, pal. I'm not responsible for it. Do it yourself. He's got a nicer mower than I do. But, so, that's been my little adventure in the netherworld we call the United States. It's been very odd. But anyway, I'm going to wrap this up here. As usual, I went way longer than I wanted to, but please, if people are going to continue, I have so much more I could say on this. Like, there's a YouTuber right now, real quickly, who he was basically feeling really down and everything. So he went and took the 2020 thingy in the arm. Now he has cancer, kidney cancer. He already had one kidney removed. Now he has kidney cancer in his only remaining kidney. So why would you go back to the same system that poisoned you and gave you cancer and expect those people are now going to help you and get you better? And I spent like an hour one day here one morning, and I sent him all kinds of links and all kinds of stuff he could check into, alternatives. I don't know if he did or not, but he continues to upload, updating everyone on his frustrations in his medical journey. People don't learn. People just don't learn. So anyway, I wish you all well if you are struggling with anything. And I don't really have anything else to say. So hope you're all doing well, and happy pre-fall. It's almost fall here. It's cool. Leaves are turning already. It's weird. But all right. Thanks. Bye.